Now, the features of this mask include, on the upper border, we have a thin aluminum wire to secure it on our nose. On the outer blue side, we have pleats going downward, and when we flip it over, the inner side is the white side, and we have pleats going upward. Now, the mask itself actually has 3 layers of fabric, and we are going to look at that next. Here, when we dissect the mask, we can see there's an outer layer, a middle layer, and an inner layer. Starting with the outermost layer, the blue side, I'm putting some water on here so you can see that it is water resistant. That means it will not allow body or blood fluids to get in. On the innermost layer, it is also water resistant, so it will prevent saliva and mucus from going out. The middle layer is the filter. It will do 80 to 99% bacteria filtration, and it filters particles in both directions. All right, so now it's time to put it on and then take it off. Don't forget your hand hygiene before and after. Let's get started. With the blue side facing out, place that thin metal wire along the bridge of your nose, holding on to the upper 2 ties. Secure this behind your head, and I'm going to use a bow tie here for easy removal. Once you have the upper 2 ties secure, you're going to grab the bottom 2, pull that mask underneath your chin, and continue to secure these behind your head using the ties. Proper removal of the mask is an important step to prevent the spread of infection. Touching only the ties and not the surface of the mask, untie or tear the lower ties first, and then untie or tear the upper ties, remove the mask from your face, and dispose of in a proper receptacle. So now you know the science behind the mask, how it's going to best protect you, and how to use it. So if you're in practice and you see someone who's got this on upside down, inside out, stop them and let them know the right way.